Hello, everyone. My name is Dominique Noel, and I serve as part of a team of community cancer control specialists at Rutgers CINJ. And today I'll be talking to you about LGBT health with a focus on HPV and cancer prevention for the Summer Health Series. So before I get into the content of today's presentation, I want to go over some quick objectives for today. So by the end of today, I want you to be able to, number one, describe the meaning of the LGBT acronym. Number two, describe the cancer disparities and barriers to cancer prevention and screening in the LGBT community. Number three, describe and define HPV. And lastly, to be able to describe HPV prevention and screening methods for HPV-associated cancers. So before I move forward, I want to just briefly clarify what exactly or who exactly am I talking about when I say LGBT health. So the term or the acronym LGBT stands for lesbian, gay, bisexual, and transgender. The term lesbian refers to a woman who is attracted to other women. The term gay refers to anyone who is attracted to people of the same gender. It's sometimes used interchangeably with the term lesbian, but it mostly is used to describe men. The term bisexual refers to a person who's attracted to both men and women. And the term transgender refers to someone who does not identify with the sex they were assigned at birth. So this could mean someone who is assigned male at birth, but identifies as female, or someone who was assigned female at birth but identifies as male. You may have heard the term non-binary. The term non-binary refers to someone who may have been assigned, let's say, either male or female at birth, but does not identify with any specific gender. So the term binary refers to bi, which means two genders. So someone who is non-binary means that they don't identify with that system of having just male or female. They're kind of beyond just being male or female. And so some non-binary people might identify as transgender, some might not. So now that I've talked about the meaning of the LGBT acronym, I want to go right into LGBT cancer disparities. So when it comes to cancer in the LGBT community, we know that this community is impacted by certain cancers at higher rates. The reason is because there are many barriers to cancer screening, including healthcare discrimination, as well as disparities in employment and health insurance access. So when I say healthcare discrimination, some examples of that might include providers flat out refusing to treat LGBT patients, which actually happens a lot. It's unfortunate. It could also mean providers not using very affirming language to describe or talk to LGBT patients. So it might include them saying derogatory terms or derogatory, things about their identities and not being very respectful. And then this other thing about employment and health insurance access. So we know that in the US, the vast majority of people get their health insurance coverage through their employer. And what we know is that the LGBT community faces high rates of employment discrimination. And when you have low rates of employment, you have low rates of health insurance coverage. So that's a very major barrier when it comes to cancer screening. We know that lesbian and bisexual women specifically are at increased risk of breast, cervical, and ovarian cancer compared to straight women due to these barriers. We know that gay and bi men, especially those living with HIV, have an increased risk of anal cancer. I'll discuss this later. And we know that trans people specifically are at increased risk of anal, liver, and lung cancer due to higher rates of HIV, smoking, and alcohol use, which are often used to cope with the stress of facing discrimination in society or being treated differently in society. People tend to turn to alcohol and smoking to kind of cope with that anxiety and that stress. So I want to just hone in on HPV-associated cancers in the LGBT community. So when it comes to HPV, most people just in general tend to associate it with young girls and with cervical cancer. And while it is true that HPV can cause cervical cancer, it can also cause other cancers in the body, like anal and head and neck cancers. Oftentimes, our sexual health education tends to focus on straight couples and straight sex, And so when it comes to HPV and other STDs, people tend to assume that LGBT people are somehow not at risk, but that's very false. And it's part of the reason why there are such low rates of awareness of HPV within the community and low rates of awareness of how these cancers can form from HPV in this community. So that's a major barrier when it comes to HPV-associated cancers. I'll discuss this later, but national HPV vaccination data does not actually collect information on gender identity or sexual orientation, but there's evidence, like the information that I just mentioned in the previous slide, that the LGBT community has lower rates of vaccination and lower rates of cancer screening because of those different barriers that I mentioned. Okay, so now that I've talked about the reasons behind different cancer disparities in the LGBT community, I want to just focus on HPV-associated cancers. But before I actually do that, what exactly is HPV? So HPV stands for human papillomavirus. It's a virus that is passed through intimate skin-to-skin contact during vaginal, anal, or oral sex, not necessarily through blood or bodily fluids as is commonly assumed. There are actually more than 200 different types or strains of HPV. Practicing safer sex, while it's obviously very important, is not necessarily as effective as getting the HPV vaccine at preventing HPV and its cancers. I'll discuss that later. Most types of HPV will go away on its own. So just like a cold that you get, a cold is a virus infection, and so your body will clear itself naturally. So the same thing goes with most types of HPV. Some types of HPV can cause warts on the body, and some types of HPV can cause cancer of the cervix, vulva, anus, mouth, nose, throat, and penis. So I just mentioned that some types of HPV can cause warts and some types of HPV can cause cancers. So there's two different categories of HPV. There's low-risk HPV and then there's high-risk HPV. So low-risk HPV is called low risk because it does not cause cancer. However, it can cause warts on the body. Low-risk types HPV 6 and 11 are responsible for most genital warts cases. On the other hand, high-risk HPV is called high risk because it can cause cancer. High-risk HPV types 16 and 18 are responsible for most cervical cancer cases. So who exactly does HPV affect? So HPV is actually the most common STD worldwide. It affects nearly all sexually active people, regardless of how they may identify in terms of their gender identity, sexual orientation, and number of partners. I say this because not only is HPV often associated with young girls and straight people, but also because people tend to have this idea that if they're in a long-term monogamous relationship, that HPV is not an issue for them, but the fact of the matter is your partner may have had previous partners, and so you can still be exposed to HPV in that way. As I will discuss next, people with HIV are at high risk of developing cancer as a result of HPV infection. So HIV stands for human immunodeficiency virus. It's a virus that weakens the immune system by attacking white blood cells that fight disease and infection. HIV and HPV are strongly associated because they're passed in similar ways. As I mentioned before, HPV is passed through intimate skin-to-skin contact during vaginal, anal, oral sex, and HIV is passed through unprotected vaginal and anal sex, as well as injection drug use. HPV-associated cancers are more common among this group because when you have a compromised immune system, it tends to make it easier for HPV infection to progress to cancer. The other important thing that I want to talk about is cigarette smoking. So we know two things. We know that people living with HIV actually have higher rates of cigarette smoking because of the stress of dealing with maintaining your health and taking medications and dealing with your status. We also know that people who are LGBT have higher rates of cigarette smoking because oftentimes tobacco companies will actually target LGBT people in their advertisements. And also tobacco companies will often sponsor LGBT events. And we know just generally that LGBT people tend to experience different stressors in society, like being treated differently, which leads people to want to smoke because to deal with that stress. So when you have all of these different things like cigarette smoking and HIV infection and HPV infection, you have an environment for cancers to develop. And so that's very important to keep in mind as we move forward. So now that I've talked about HPV infection, I want to talk about different ways to prevent HPV infection and its cancers. So the most effective way to prevent HPV and its associated cancers is by completing the HPV vaccination series. So what exactly is the HPV vaccine, more commonly known as Gardasil? So the HPV vaccine is a cancer prevention vaccine. It was developed using clinical trials. It protects against high risk and low risk HPV types, which are responsible for cancer and genital warts. And the vaccine available in the United States is the 9-valent HPV vaccine, which protects against the types of HPV most often responsible for cancer and genital warts. When it comes to discussing HPV with LGBT clients, it's crucial for providers to talk about the HPV vaccine because there's evidence which suggests that underserved populations tend to have lower vaccine uptake. And so if we can address these disparities and talk to LGBT people about HPV and lowering their risk, we'll be able to prevent so many cancers. So when it comes to the HPV vaccine, who should be getting it? So it's recommended to get the HPV vaccine at age 11 to 12 for all boys and girls. It's recommended to get 2 doses over the course of 6 to 12 months. If you're getting it at age 15 or over, you want to get 3 doses over the course of 6 months. For some people who maybe started the HPV vaccine during their childhood or did not get the HPV vaccine at all during their childhood, there's something called catch-up vaccinations. These are approved for safety through the age 45 for those who have not been adequately vaccinated. So notice how I'm saying approved for safety, not recommended. So I'm saying that because technically the HPV vaccine is recommended from age 11 to 12 up until the age 26. However, it's approved for safety up until the age 45, meaning that your insurance coverage may differ after the age 26. So talk to your doctor about this, although it's less effective after you've been exposed because it does not necessarily kill off any existing HPV infection. It can prevent new HPV infection and associated cancers, so it can still be beneficial. So when it comes to the HPV vaccine, many people struggle with this idea, or to struggle with the issue rather, of not knowing whether or not they got the HPV vaccine. So if you're unsure of your vaccination history for HPV, there are several ways for you to locate your vaccination records. One thing you can do is ask your parents or legal guardians, if possible, to see if they remember or if they have your records. Another option is to check with your high school or four-year college if you recently finished high school or college, because they might still have your vaccination records. Another option would be to check with previous employers, as some employers, like for example, the military, require vaccinations. Another option might be to check with your state's health department, as some state health departments have vaccine registries. Another option would be to go online to the New Jersey Immunization Information System, which collects vaccine data on children in New Jersey. If none of these things are successful in helping you to locate your vaccination records, discuss starting the vaccine series with your doctor. So many people often ask, how safe is the HPV vaccine? So the HPV vaccine is very safe, and it provides effective and long-lasting protection against HPV and its associated cancers. It's monitored for the safety of it by the CDC and the FDA. And in terms of possible side effects, the side effects are mild and they go away quickly, if at all. They might include temporary pain, redness or swelling, fever, dizziness, nausea, or headache. But keep in mind, not getting the HPV vaccine when recommended is actually more dangerous than getting it, because not getting the vaccine can put you at risk of different cancers, which can cause infertility and even death. So when it comes to HPV, many people often ask, what about practicing safer sex? How effective is practicing safer sex at reducing my risk of getting HPV? So we know that using barrier methods, like what I'll discuss next, like dental dams and condoms, provides some protection against HPV, but the HPV vaccine is significantly more effective at preventing HPV and its cancers. So when it comes to practicing safer sex, what are your options? So the condom, I think we've all heard of the condom. It's a barrier for anal, vaginal, and oral sex. It's recommended to use in conjunction with water-based or silicone-based lubricant. Notice how I'm saying water or silicone-based, not oil or oil-based, because oil and oil-based lubricant can actually degrade the material of latex and make it less likely to be effective. It can tear more easily, in other words. The dental dam, which many of you may not have heard of, is a safer sex barrier for oral sex on a vulva or an anus. It's recommended to use in conjunction, like with a condom, with water or silicone-based lubricant for the same reason as I just discussed. So many people often ask, if I find out that I have high-risk HPV, does that mean that I have to refrain from engaging in sexual activity? The answer, generally speaking, is no. However, you should definitely avoid having sex of any form if or when you have visible warts on the body, even with barrier methods, as there may be warts where they don't cover. Okay, so now that I've talked about HPV and different ways to prevent HPV-associated cancers, what I want to do now is talk about some of the screening guidelines for those HPV-associated cancers. So the first guideline, which I will go over today, is from the U.S. Preventive Services Task Force, or the USPSTF. This is for cervical cancer screening. Please keep in mind that these guidelines should apply to anyone who has a cervix, which includes cisgender women or people who were assigned female at birth and also identify as female. It might include some transgender men who were assigned female at birth and identify as male. Some transgender men might still have a cervix in some cases. And it can also include some non-binary people or people who don't identify as being either male or female, as some non-binary people may have been assigned female at birth and might still have a cervix. Just a quick note, some people ask, what about if a transgender woman has undergone gender confirmation surgery or bottom surgery to construct a vagina out of a penis? Would she require cervical cancer screening or pap smear? The answer is no. She'd require something called a pelvic exam. Also keep in mind that these guidelines do not apply to people with a cervix who have a compromised immune system or who have had cervical cancer or a high-grade precancerous cervical lesion. This would require more individualized follow-up. Also keep in mind that people who have undergone something called a full hysterectomy, meaning that they have had both their cervix and their uterus removed, would not require screening for cervical cancer if they don't have a history of high-grade precancerous lesions or cervical cancer. So before I actually get into the actual screening recommendations, I want to just go over anatomy. So many people are not really clear on the difference between internal female anatomy and external female anatomy. So on the left-hand side of my screen here, I have a diagram showing the internal female anatomy. So you see the ovaries, the fallopian tubes, the uterus, the cervix, and the vagina. So the cervical cancer screening test will look at where the cervix is in this diagram. On the right-hand side of the screen is an external part of the female anatomy, which is called the vulva. So the part that you can see is called the vulva, and the internal part is where the cervix, the vagina, and the uterus are located. So the USPSTF guidelines are to start screening at age 21 and generally stop at age 65. It's recommended to start getting a pap smear alone every 3 years between age 21 and 29. Once a person with the cervix hits the age 30, between age 30 and 65, they would have 3 different options for screening. One option would be to again get the pap smear test by itself every 3 years. Another would be to undergo something called high-risk HPV testing every 5 years. And the other one would be high-risk HPV and pap co-testing every 5 years. There are different options in this age group for screening, but the most important thing is regular screening to prevent cervical cancer deaths. Once a person with the cervix hits the age 65, generally speaking, they should not be screened if they have had an adequate screening history and are not at higher risk for cervical cancer. However, screening will continue for those with an inadequate screening history or who are at high risk. So before I move on, I want to do a quick note about cervical cancer screening for transgender people. So the first thing is that for transgender men, for example, they may have undergone something called hormone therapy, and they might have taken testosterone. So if a transgender man has undergone hormone therapy or taken testosterone and still has a vagina, what can happen in some cases is vaginal atrophy, which is where the vagina experiences like dryness. This can make getting a pap smear uncomfortable and even painful in some cases. So some things that a provider can do to accommodate transgender clients would be either using a smaller speculum to do the pap smear, or choosing to just do the HPV test alone without a pap smear. The other thing is putting some warm water on the speculum before insertion to make it more comfortable for the client. So I also mentioned that HPV can cause something called anal cancer. So there are actually no official anal cancer screening guidelines. However, it is important to discuss anal cancer screening with high-risk groups, like people with a history of receptive anal sex, people with a history of cervical or vulvar cancer, people with HIV, people with an organ transplant history. Many experts do recommend doing an anal pap smear alone every 1 to 2 years among HIV positive men who have sex with men, and every 2 to 3 years for HIV negative men who have sex with men. It's also recommended for some cisgender women living with HIV and women with a history of cervical dysplasia. Some screening methods for anal cancer might include an anal pap smear, digital anorectal exam, and a high-resolution endoscopy. So I also mentioned that HPV can cause oral cancer. So there is actually no official screening test for oral cancer. Some dentists will actually examine the entire mouth to check for oral cancers early, and some experts do recommend that patients look in the mirror every month on their own to check for any changes in their mouth, like white patches, sores, or lumps. Screening tests for these cancers are being looked at in clinical trials, and it's important because the vast majority of oropharyngeal cancers have been linked to HPV. It's also important because oral cavity and oropharyngeal cancer is more common in men as compared to women. Okay, so now that I've talked about screening guidelines, what I want to do is talk about screening and follow-up procedures. So the first procedure that I want to talk about is called the cervical pap smear. So a cervical pap smear or cervical cancer screening test is not an HPV test. It's a procedure where a small brush is used to take a sample of cells from the cervix for review under a microscope. This exam checks for cancerous or precancerous cells of the cervix. In some cases, after an abnormal pap smear or a positive HPV test result, which I'll discuss later, something called a colposcopy may be done. This is where a magnifying instrument called a colposcope looks at the cervix, vagina, and vulva to check for any changes. This also may be done if you show symptoms of cervical, vaginal, or vulvar cancer. This can include symptoms like abnormal bleeding, pelvic pain, or things of that nature. So the HPV test is a lab test which detects high-risk HPV types. This test looks for the virus that can cause cervical cell changes. So the cervical pap smear checks for cancerous or precancerous cells of the cervix. The HPV test looks for the virus that can cause these precancerous or cancerous cells of the cervix. So the anal pap smear, or the anal cytology, as I mentioned before, is a procedure where cells are scraped from the lining of the anus with a Q-tip while you lie on your side. It's used to find cancerous or precancerous cell changes that may lead to cancer. The digital anorectal exam is an exam where a doctor inserts a lubricated gloved finger into the rectum to check for any abnormalities. The HRA test is where a small plastic tube is inserted into the anus for better view, and a colposcope is used to look at the anus through the plastic tube. If an abnormal area is identified, a biopsy or tissue sample can be taken. So I want to just briefly go over potential screening results. So in the case of a cervical pap smear, there are 3 potential results: a normal result, an unclear result, or an abnormal result. So a normal cervical pap smear or pap smear result essentially means that no cell changes were found on the cervix. The next step would be to consult with your doctor, come back in 3 years, and if you had a positive HPV test done alongside with this, you would do follow-up testing. The other potential result is the unclear pap smear result. This means that cervical cells could be abnormal due to pregnancy, menopause, or HPV infection. It is recommended to do HPV testing to understand what's going on there. The other potential result is an abnormal pap smear result, which means that cell changes were in fact found on the cervix. Usually it is not cancerous, but follow-up testing is recommended. So the HPV test. So there are 2 potential HPV test results. There's negative and then there's positive. So a negative HPV test result pretty much means that you do not have an HPV type linked to cancer. You do not have a high-risk HPV type. On the other hand, a positive HPV test means that you do have an HPV type linked to cancer or a high-risk HPV type. In both cases, talk to your doctor about following up. So now that I've talked about HPV, different ways to screen for it, the different guidelines, and how to prevent it, I want to just briefly talk about improving LGBT health as it relates to HPV and cancer prevention. So when it comes to addressing cancer disparities in the LGBT community, you must keep in mind that in some cases, specifically when it comes to transgender clients, changing gender markers on health insurance policies may wrongly cause some insurers to assume that certain screening exams or procedures are not covered. So for example, if a transgender man has changed his gender marker to male and he still has a cervix, an insurance company might assume that because on his insurance policy it says male, that a pap smear should not be covered or an HPV test should not be covered. In order to combat this issue or address this issue, in order for you to be an LGBT affirming agency, you want to have navigators for insurance coding at your agency to ensure that things are coded so that it's still covered. The other thing is having LGBT specific cancer awareness campaigns. So I'm saying this because, for example, if you're trying to encourage transgender people, or transgender men specifically, to get cervical cancer screening done, you don't want to be calling it a women's health program. You want to have a transgender specific campaign or program. You want to have trans people involved in the development of the program and in the creation of the program. You want to have them shown in the advertisements, right? You want to have a population specific cancer awareness campaign. The same goes for if you're trying to address cancer screening among lesbians, gay men, bisexual people. You want to have a population specific cancer awareness campaign. And of course, when it comes to addressing HPV and its cancers in this community, you want to encourage completion of the HPV vaccine series for both males and females, especially those living with HIV. When it comes to being LGBT affirming, ongoing LGBT cultural competency training is necessary, right? So no one training is going to have everything that you need to know to effectively reach this community. You want to do ongoing competency training for both providers and front desk staff, because the experience of being at a doctor's office does not start in the doctor's office. It starts in the waiting area where they're seeing front desk staff. The other thing, if you are not yet trained in LGBT competence, what you want to be able to do is refer your patients to LGBT or trans affirming sites if you're not trained yet. The other thing is hiring LGBT staff members. In order for you to effectively serve this community, you need to have people on your workforce who are part of the community. And when it comes to establishing an LGBT affirming healthcare environment, you want to have culturally relevant information about HPV and cancer screening. So you want to have same-sex couples shown in the materials. You want to have diversity in who you're showing in your patient handouts. You want to have culturally specific or relevant information targeting the LGBT community in relation to HPV and cancer. The other thing is collecting data on sexuality and gender identity in your intake forms. That's very important for demographic purposes. And the other thing is doing comprehensive sexual health testing, asking about specific behaviors and being non-judgmental when doing so. So just a quick note on LGBT organizations in New Jersey. So you have the RWJ Somerset Babs Dipperstein Proud Center, which is an LGBT health center. You have Proudly Me, which is a transgender EduPort program, educational/support group program. It's virtual now that COVID has hit. You have Q-Spot, LGBT Community Center. You have VNA Central Jersey, LGBTQ Center for Health and Wellness, Garden State Equality, Iris House, Hyacinth AIDS Foundation, and the Pride Center of New Jersey. So these are all LGBT centers and groups in Central Jersey. So just to address some FAQs or frequently asked questions. Where can I find more information about how to be an ally to the LGBT community? Okay, so one example might be going onto the HRC or Human Rights Campaign website to find information. They have fact sheets on how to be an effective ally. The other thing is looking onto the GLAAD website or the Gay and Lesbian Alliance Against Defamation. These websites both contain information about how to be an effective ally. The other thing is the other FAQ is what are some ways to increase cancer screening among LGBT people? So as I discussed in the presentation, some ideas would be including LGBT people in cancer awareness campaigns, hosting LGBT events, and having population-specific cancer awareness campaigns. So for example, having a trans-specific cancer awareness campaign. The other FAQ is where can providers find information on how to provide LGBT affirming healthcare? So one website is the UCSF Center of Excellence for Trans Health, and another one is for the Fenway Institute. These are both leading LGBT health organizations. Okay, so just to end off today, I'm going to just do some quick key takeaways. So the main thing I want you to take away from today is that HPV is transmitted through intimate skin-to-skin contact. So it's not about who's straight and who's not straight or who's gay and who's not gay. HPV can affect anyone and everyone of different identities, sexual partners, and so on and so forth. The other key takeaway is more awareness about HPV prevention methods is necessary, including the HPV vaccine and practicing safer sex within the LGBT community. The other thing is that providers should be regularly attending competency trainings and to be knowledgeable about ways to be LGBT affirming. So here's some more information from the National LGBT Cancer Network, from Fenway Health, from OncoLink, from ACS, and from Rutgers CINJ. Here's my contact info. So it's my name, position, organization, work number, and email. All right, thank you everyone for attending today.